If you would like to watch this video with captions of another language, please click on the settings symbol, then go to the subtitles, select Auto Translate and choose the language of your choice.
But why have a transplant? If you are successful in receiving a kidney, there are a number of advantages. You are no longer spending the time doing dialysis, you have an improved diet, and fluid restrictions are less. You're able to travel without the restrictions that dialysis poses. And because you have a good kidney, there are general health improvements as well, as benefits to your family life and more abilities to work. And after the first year, there are also cost benefits to the hospital, as dialysis costs a lot of money to perform. With transplant, you will actually require more frequent follow-up with doctors for the first 12 months. But if all goes well, then the follow-ups become less frequent. There are two types of donors for transplant. Your living donors, so that could be a close relative, a family member, a friend, whose tissue typing is close to yours. With donor kidneys, these come from a person who has been declared either brain dead or has suffered heart failure and life cannot be sustained. The process for all first involves doing a lot of tests, and once those testing is completed, the results are reviewed by doctors and surgeons. And if cleared to be transplanted, you are either listed on the wait list, or if a live donor, dates for transplant are discussed. With live donors, sometimes the blood match is not perfect, but we do have more options, such as entering the paired kidney exchange, where we swap kidneys so you get a better tissue match. If you're being listed on the deceased donor list, you must be on dialysis before you can be listed. You need to send in monthly bloods and you need to be contactable at all times. Often we find things that you had no idea about, but we often find these problems early so they can be fixed and then you can proceed to transplant. If you are smoking, you must stop, as smoking affects your blood vessels, and this could impact badly on your transplant and even lead to losing your transplant and needing to go back to dialysis. The bloods that we take, we do your blood group. For live donors, we don't need to be matched with the blood group because we can do what we call an ABO-I, or blood grouping compatible blood transplant. But with this, there are more blood tests required and more treatment before transplant. We then look at your tissue typing. And then we also mix the blood with you and the donor to make sure that there's no reactions. If there's no reaction, we call that a negative cross-match and the transplant could go ahead. So for a transplant or to donate, you do need to undergo surgery and an anaesthetic, which has its own risks. You will need to take anti-rejection drugs for the life of the kidney. It is important to continue to do your yearly checks, especially your cancer checks. So this was only a very brief overview of transplant, and I would encourage you to attend an education session on transplant. If you are interested in having a transplant or have a potential donor, discuss with your kidney specialist and he will refer you to me. There are lots of online forums about transplant, but not all are reputable. It is illegal in Australia to purchase a kidney for transplant and may lead to prosecution. So I encourage you not to Dr. Google, but to seek information from your kidney doctor or from Kidney Health Australia.